Dr. Mark Hyman begins by highlighting the growing epidemic of dementia and Alzheimer's disease. He notes that by 2030, an estimated 8.5 million Americans over 65 will be living with Alzheimer's, with projections reaching 14 million by 2050. Globally, 55 million people currently live with dementia, expected to increase to 82 million by 2030. The economic impact is staggering, with direct and indirect costs in the U.S. reaching over $360 billion in 2024, potentially rising to $1 trillion by 2050. Despite enormous research efforts, including 292 interventional trials funded by the National Institute on Aging since the early 2000s and 171 ongoing studies in 2024, the failure rate for drug candidates exceeds 99%. Approved drugs are considered successful if they slightly slow progression with no reversal of symptoms. Dr. Hyman introduces Dr. Heather Sandison, highlighting her work in addressing dementia through a new approach. He emphasizes that some practitioners, including Dr. Sandison, Dr. Dale Bredesen, and himself, have observed cases of dementia reversal, not just slowing progression. Dr. Sandison explains that she initially approached this field as a skeptic, having been trained to believe nothing could be done for cognitive decline. However, her experiences with patients prove that reversing the disease process and associated symptoms was possible. Dr. Sandison argues that the current approach to Alzheimer's research, focused on finding a single drug or pathway, is misguided. She emphasizes that dementia is a complex problem with multiple causes, similar to how pain can result from various conditions. The conventional model of seeking a single molecule intervention, while effective for simpler conditions, is inadequate for addressing the complexity of Alzheimer's disease. Dr. Sandison introduces a framework for understanding brain health as a complex system requiring balance. She identifies 6 key factors that can lead to imbalance and disease: toxins, nutrients, stressors, structure, infections, and signaling. These factors can be present in excess or deficiency at the wrong time or in the wrong place, leading to cognitive decline over time. Toxins include chemical toxicity, heavy metals, and mold-associated toxins. Nutrients involve both excesses, like high blood sugar becoming toxic, and deficiencies, such as insufficient B12. Stressors can be either excessive, as seen in caregivers at higher risk for Alzheimer's, or insufficient, leading to lack of engagement. Structure refers to physical brain injuries and genetic predispositions. Infections, including those in the mouth and gut, can trigger amyloid plaque production. Finally, signaling involves the brain's ability to allocate resources between defense against threats and building new neural connections. Dr. Sandison emphasizes the importance of addressing all these factors simultaneously, rather than focusing on one at a time. She describes her approach as throwing everything at the problem, including lifestyle changes, detoxification, and addressing infections. This comprehensive strategy is necessary due to the complexity of reversing neurodegenerative processes. The discussion touches on the stages of Alzheimer's, from pre-symptomatic changes to mild cognitive impairment and more severe stages. Dr. Sandison shares success stories from her practice, including a patient named Darlene, who showed significant improvement in cognitive function after implementing a multifaceted treatment approach. A significant portion of the conversation focuses on dietary interventions. Dr. Sandison discusses the use of ketogenic diets in her practice, noting the rapid improvements often seen in patients. However, she also acknowledges the recent study by Dr. Dean Ornish showing benefits from a low-fat vegan diet. Dr. Sandison suggests that the ideal approach might involve alternating between different dietary strategies, mimicking the variability in ancestral diets. She emphasizes the importance of avoiding processed foods and focusing on nutrient-dense, whole foods. Beyond diet, the discussion covers other lifestyle factors crucial for brain health, including exercise, stress management, and sleep. Dr. Sandison particularly emphasizes the importance of addressing sleep disorders, sharing cases where treating undiagnosed sleep apnea led to significant cognitive improvements. The conversation delves into other interventions and diagnostic approaches used in functional medicine for cognitive decline. These include addressing infections like Lyme disease and herpes, dental health, and toxin exposure. Dr. Sandison discusses the importance of hormone replacement therapy, thyroid function, and other factors that can contribute to cognitive decline. She emphasizes the need for a personalized approach, as different patients may require different interventions based on their unique circumstances. The podcast touches on several research initiatives and clinical trials supporting the functional medicine approach to cognitive decline. Dr. Sandison discusses her own study published in the Journal of Alzheimer's Disease, which showed improvements in cognition for 74% of participants following a 6-month personalized lifestyle intervention. She compares this to similar studies by Dr. Bredeson's group and the recent randomized controlled trial by Dr. Dean Ornish, all showing significant improvements in cognition through comprehensive lifestyle interventions. Dr. Sandison shares information about her residential care program designed to provide an immersive experience for individuals with cognitive decline. The program offers a controlled environment where patients can fully implement the comprehensive approach, including an organic ketogenic diet, non-toxic living environment, social engagement, physical activity, and cognitive stimulation. She reports impressive results, with 5 out of 6 residents showing improved cognition after 6 months in the Kansas facility. Both Dr. Hyman and Dr. Sandison express optimism about the future of dementia care, emphasizing the potential for prevention and even reversal of cognitive decline through comprehensive, personalized interventions. They stress the importance of early intervention and the need to shift the narrative around aging and cognitive health. Dr. Sandison envisions a future where older adults are not relegated to senior living facilities, but remain active, valuable members of their communities, sharing wisdom and experience with younger generations. She hopes that by implementing these approaches earlier in the disease process, more people can maintain their cognitive function and quality of life as they age. The conversation concludes with Dr. Hyman emphasizing the importance of this work and the hope it offers to those facing cognitive decline. He encourages listeners to explore these approaches, whether for prevention or treatment, and to be proactive in seeking out comprehensive care beyond traditional medical approaches. Dr. Sandison's book, Reversing Alzheimer's, the New Toolkit to Improve Cognition and Protect Brain Health, is mentioned as a resource for those interested in learning more about this approach. Overall, the podcast presents a compelling case for a paradigm shift in how we approach dementia, and cognitive decline, moving from a single drug model to a comprehensive, personalized approach that addresses multiple factors contributing to brain health. While acknowledging the complexity of the issue and the need for further research, both doctors express optimism about the potential for preventing and even reversing cognitive decline through these innovative methods.